After last night's emergency council meeting in St. Joseph, city leaders and local advocates coming together to address the issue of opioid abuse. KQ2's Daniel Soxie speaking with a council member today on what the next step should be.
We need to act now.
What is next? Now that the overdose problem in St. Joseph has been brought to light, city leaders and local advocates are taking the next step.
So if we have a detox center, we can get them in, get them cleaned up, get them back on track for 4 or 5 days, and then they can go into an outpatient medically assisted center and we can save them.
Healing centers do exist across the city like the Colby Puckett Center, but one city council member is asking for a detox center that will close the gap between long-term care and immediate help coming from hospitals.
A detox center like what we're proposing is one additional step, but people need to understand that this is not a magic bullet. This is not a cure-all. It's something necessary, but there needs to be other components in place to rid the community of the addiction issues that we have here.
St. Joseph once had a detox center, but the state cut funding and ultimately cut a vital piece in the road to recovery. But now, city leaders are willing to take matters into their own hands.
My aim is by the end of this month to have had the mayor and myself and other willing council members sit down with key stakeholders and see what budget we have to work with. And I would like to see something done as far as a formalized plan by the end of May.
Including Colby Puckett co-founder Mark Puckett, who lost his son to drug overdose 5 years ago.
And it would benefit everybody. Mosaic would definitely benefit from it because, they get a lot of homeless downtown that will pass out because they're drunk. 9 times out of 10, they're transported to Mosaic. If we had a detox center, they could be transported to the detox center and dealt with there.
Reporting in St. Joseph, Danielle Soxie, KQ2 News.
Along with the detox center, city leaders also wanting to implement educational programs on drug and alcohol addiction. So far this year, there have been 146 overdoses, resulting in 5 deaths in St. Joseph.